Go.
Hi guys, it's Justin Rabinowitz here from Strive to Move. You may remember a couple months ago we did a low back series of videos, and then we ended up doing a nice little demonstration on it at Fitness Revolution with Dave. What I want to show you today over the next couple of videos is a series on knee pain. So 3 things that we're going to do in the next series of videos. Number 1 is the proper area to foam roll when you have knee pain. The second one is going to be an exercise correction, and then the third one is going to be a nice stretch that you can do. All of them require very little equipment and may help to prevent some of your knee pain, or if you have knee pain, may help it to go away. So the first thing that we're going to do is talk about foam roll. I know most of you have seen it before, but the 2 main areas that I want you to foam roll when you have knee pain is going to be the front of your quad and then the side of your quad. Okay, so these muscles attach down to the knee, and when they get really tight, it almost starts to pull onto the kneecap and starts to yank on it, and you get really tight, and then you have pain. So when we foam roll it, it starts the process of getting those muscles to loosen up. So the way that we're going to do this is we're going to lay the foam roller down, and then we're going to take the front part of our quad, because that's the part that's tight, and we're going to start to roll over it and try to find a really tight spot. So as you can see, I'll be scanning the area first, from all the way from the top of my hip down to the top of my knee. If I find a spot that's really tight, I'll stop, I'll sit on this spot, and then what I can do is just bend my knee forward and backwards and do that about 8 to 10 reps. Then I'll find another spot, and then I'll do the same thing, okay? So that's the first spot, it's the quad. The next one is going to be the lateral quad. Now, if you're a runner, you may have heard this as the IT band. IT band, lateral quad, it's the same area. It's just a different name, doesn't really matter. We're going to do the side of the leg. The way you do this, the foam roller's in the same position. We're going to go on the side, and we're going to do the exact same protocol. Now, this area is very sensitive. So what I recommend is making sure that both hands are on the ground and your other foot is on the ground. If you start taking that off, it's going to really, really hurt. Okay, so start that way, and then find the same thing. So we roll, find a spot, and then we're going to bend and extend our knee. I would do that about 10 repetitions, then roll, and then go ahead and find another spot. Okay, so to review, the foam rolling the front of the quad and the side of the quad, the IT band, is the first step to eliminating that knee pain. On this video, we're going to talk about our lunge technique. A bad lunge technique can put you in a really bad position and make your knee hurt. So what I see from most people, and we're going to show 2 different angles, is when people go to do their lunges, what happens is that their knee starts to move inside of their toe. When they move inside of their toe, this puts a lot of strain on the knee. What we want to do is take the knee and put it in proper alignment, which is aligned with the hip and the foot. Actually, if you see, I'm almost biasing by pushing it out. So I never want to be here. I always want to be in alignment or even a little bit further out. So a bad lunge would look like this. Okay, alignment not good. A good lunge would look like this. My knee is right in alignment, I'm straight down and I'm straight back up. Now I want to show you from the side because there's another technique fix, okay? So the next problem that we have is when people lunge, they lunge with their knee too far out over their toe. When you do that, you start to put a lot of pressure on the front of the knee and it becomes very quad dominant, which ends up pulling on the knee, and that's a problem. So what we want to do is keep our knee in alignment behind our toes. So I'm almost going to sit straight down, so my knee is back as opposed to my knee going forward. Okay, so to review, we want our knee to be in alignment. We don't want it to cave in. Okay, and then from the side position, we want our knee to be straight up and down. We don't want it to go too far forward. Okay, that's step 2 to fixing that knee pain. This is part 3 of the getting rid of your knee pain video. So part 1, we talked about foam rolling, the quad, and then the side of the quad or the IT band. Part 2, we talked about alignment. So when we lunge, we don't want our knee to cave in. We want it to be in alignment over our foot and our hip. And then part 3, we're going to talk about a stretch, okay? Now they call this the couch stretch because you can do it at home and use your couch. Now I'm going to use my table in the office to show you, but this is a really great quad stretch which is going to take pressure off the knee. So the way we set this up is we're going to go down on a knee, and I'll grab my balance pad just so I protect my knee. I'm going to go on a balance pad. You can use a towel or a pillow at home, doesn't matter. I'm going to take my foot and I'm going to put it up onto the table or the couch. Now from here, you see how I'm far forward? As I start to sit upright and bring my chest up tall, I'm going to start to feel a huge stretch through the front of my quad and my thigh. I'm I'm gonna hold this for about 30 to 40 seconds, even up to a minute. And what I wanna do is make sure I do it on both sides. Now, if one side is tighter than the other, you wanna spend more time on the tighter one so that you have a balanced set of legs. You don't wanna go and be squatting or doing any exercise with an imbalance or a muscle imbalance. That's gonna lead to injury, okay? So this stretch, we call this the couch stretch or the table stretch. It's gonna stretch the front of your hip, and that's step 3 to eliminating knee pain. Hope you enjoyed this series, and we'll look out to seeing you soon. Thanks.